both T-DM1 and T-DXd are fairly well-tolerated agents. And so the average experience of patients is that they tolerate well, they don't have major side effects. It is important to remember that nausea and vomiting are common and need to be managed proactively. And it's important to prescribe adequate prophylaxis with 3 drugs regimens, since T-DXd has been associated with high emetogenicity. So I think when you have an adequate prophylaxis in place, nausea becomes not so frequent and very manageable. Apart from that, it's important to remember that T-DXd and both T-DXd and T-DM1 have anti-HER2 antibodies, and so they can cause cardiac toxicity. Usually this is uncommon, less than 10% of the patients. It's reversible, it's usually low grade, but it's important to monitor patients with echo at baseline and during treatment. Important also to remember that these drugs carry chemotherapy, and so they can cause cytopenias. These are also usually very well manageable. And finally, with T-DXd, it's extremely important to remember the risk of interstitial lung disease. And so we know that approximately 10 to 15% of the patient receiving T-DXd and much less than 1% with T-DM1 will have interstitial lung disease. And it's important to remember that we have to perform CT scans of the chest for these patients every 6 to 12 weeks in order to diagnose interstitial lung disease early. And whenever there is suspicion of ILD, stopping the drug and giving steroids to the patients. And the drug can be only restarted if ILD was asymptomatic, was just noted on the scans, and it resolves. We are trying to understand if we can also reintroduce the drug in patients that had mild symptoms or where the ILD doesn't fully resolve. But for the moment, for our understanding, in order to avoid high-grade ILD, it's important to stop the drug and give steroids. And DESTINY-Breast03 really reinforce the idea that if you have an adequate awareness and management of ILD, you can avoid fatal cases, because in DESTINY-Breast03, despite a prolonged exposure of the patients to a drug, to T-DXd, there were no grade 5 ILD episodes. And so this was very important, but it can still happen, and this is why extremely important to remember this side effect.